Good afternoon and welcome to today's COVID-19 update. I'm Heather Fairbairn and I'll be your moderator today. Before we begin, allow me to introduce the Honourable Iain Rankin, Premier of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Premier?
Thank you, Heather. Some sad news to report today. We lost another Nova Scotian. This individual was in their 50s and died in the hospital. So our condolences on behalf of all Nova Scotians go out to the loved ones of the individual that we lost. That's still another reminder, this latest death, how deadly this disease can be, and it is still lingering in our province. The good news is we are managing to contain it. Today we are reporting 8 cases of COVID in our province, and that's the first time we've seen single digits in a very long time. But we can't let our guard down. It's good to see such a small number of cases, and it's thanks to all of you for following the public health guidelines that we put together for Phase 1. We are still in Phase 1 and will be for the weekend. But if all goes well, we will be entering Phase 2 next week. That means businesses will be able to open a little more and we can add a few more friends to our bubbles. That will start next week as long as the weekend goes well. I understand our businesses are anxious to reopen indoors, and that day is around the corner. I want to thank you for your patience and for being innovative. It's been a long haul, but it is my hope that as we start to open indoors, whether that be at our restaurants or at our gyms or expanding at our retail, we will be opening with the peace of mind that we are safe and that we can continue to follow the right restrictions based on public health advice. I have been in discussions with my Atlantic counterparts about the possibility of bringing back the Atlantic bubble. All of us as premiers want our region to be safe and successful. It will depend on how each province approaches the reopening plan. We are all working together and with our public health officers. It's my hope that we can find a way to revive the Atlantic bubble. I want to thank my fellow premiers for making themselves available. I continuously have conversations with them, and I hope to talk to them later today as well. I want to take a brief moment to talk about grade 12 students. I know you're in the final weeks of high school and graduation is on your mind. And Dr. Strang will have more to say to this, but I know that you've been thinking a lot about your high school send-off. Another year of COVID and another year of missing out on a formal celebration. Your schools will make sure you have a proper send-off when you receive your diploma. It won't be a large gathering, but you will be honored. For communities who want to do something on a larger scale, we have to be careful. We want you to celebrate your grads, and we want your grads to feel special. So if a community wants to celebrate their grads, we are not saying no to community-sanctioned events, but there will be serious restrictions. And before I turn it over to Dr. Strang, I want to acknowledge that today is Davis Day, the day we remember Cape Breton miner William Davis. He was killed during the general strike of 1925 while marching for labor rights and a better life for all miners. Let's reflect too our mining heritage and the contribution miners have made to our province. Thank you, and I'll turn it over to Dr. Strang.
Thank you, Premier, and good afternoon, everybody. My thoughts and prayers also go out to the family and friends grieving today. Please accept our condolences. As the Premier mentioned, our case count today is 8, and most are linked to close contacts of other cases or travel. This week, cases are consistently low, and today is the first single-digit reporting since April 9th. And that's a reminder of how far we've come in a relatively short period of time. I expect, though, that we will see similar numbers for a number of days because there is still limited community spread in the Halifax area. And a new concern here now is the Delta variant, and that we have had 2 cases with that Delta variant several weeks ago in Nova Scotia. As I said, they were previously reported cases, and they were isolating at the time. There was no further spread, but we do have to be aware of that other provinces where the Delta variant is becoming more predominant, and have caution. The Alpha variant has been here for a while, and it did drive the 3rd wave. And this new Delta variant is also more transmissible, but it's even more concerning because single doses aren't very effective against this latest variant strain. And so that is why we have to remain, key reason why we need to remain cautious while we build our second dose coverage as well. And it has been, we have seen that the Delta variant in other parts of Atlantic Canada, specifically New Brunswick, and the efforts that, I know the efforts that they had to go to bring it under control. So as I've said before, along with getting vaccinated, the main way for people to help us get out of the third wave as quickly as possible is through regular testing. With the Delta variant here, it makes testing even more important. All of us need to make testing a regular part of our pandemic routine. We need to dig out all the COVID-19 in HRM and around the province. Testing is critically important to allow us to make the best possible decisions around reopening. And Nova Scotia has been a leader in Canada in asymptomatic testing. It's an important part of preventing and reducing the spread of COVID-19 since last November. And we have a number of asymptomatic testing streams to that add layers of protection for all Nova Scotians. Since last fall, there have been more than 460 pop-up testing sites and more than 210,000 rapid tests have been administered around the province. And those numbers continue to grow each week. People are also getting tested at the 34 primary assessment centers hosted by NSH and IWK. We have been testing professional truck drivers with a unique self-test program. This week, we started testing domestic passengers at the Halifax airport. Mobile testing units have been used around the province, and in partnership with HRM, one of them will be going to outdoor venues around the municipality in the coming days and weeks. Regular facility-based testing for staff in licensed long-term care and provincial correctional facilities has also been going on for a while. But today I'd like to talk in a little bit more detail about our new rapid screening program for workplaces. The program has been piloted for several weeks now to make sure we get it right before we expand it. The program supports employers across the province to put in place regular screening for their staff. We now have 275 businesses signed up during this stage, and they employ more than 50,000 Nova Scotians. And the participating businesses are big and small and cut across sector lines. For example, we have food processors, restaurants, retail stores, transportation, and construction firms involved so far. What brings them together is knowing that regular testing is good for their business, good for their employees, and good for their communities. The province has partnered with chambers of commerce across Nova Scotia, the 7 regional enterprise networks, global nonprofit Creative Destructive Lab, and the federal government to get this initiative up and running. And we are ready to welcome more businesses to the program. Interested employers can learn more about the program and how to sign up at novascotia.ca/coronavirus/working during COVID-19. That's a big mouthful, so we'll make sure you get that. But if you go to our coronavirus website and look under workplaces, you'll get to that link. To participate, organizations must have an approved testing plan in place. There's information at the site about how to create this plan. In the province, we provide the test kits for free thanks to the federal government. So I encourage businesses to explore what the initiative is and how it works. As the Premier said, this is an exciting month for our grade 12 students. They are doing their final assessments and preparing to graduate. Schools will be holding graduation ceremonies to mark this important and happy milestone in these young people's lives. And the ceremonies will follow reopening protocols. And to the graduates, let me offer you a hearty congratulations. You have had 2 very challenging years due to COVID-19, but you should be very proud. You have risen to the challenge and succeeded. I know you're disappointed there can't be regular, large proms or community gatherings to celebrate your accomplishments. I wish it was different myself. But like school graduation ceremonies, any community celebrations of graduates will need to follow the reopening protocols. We hope to soon be in the second phase of reopening, and in that phase, there can be formal gatherings of up to 10 people indoors and up to 25 outdoors. However, we are still emerging from the third wave with a very infectious variant strain, and so larger graduation gatherings, including drive-in graduations, carry too much risk. That means communities will need to be creative and innovative again in celebrating their graduates. One example I've heard is a drive-past celebration. Graduates can be sitting outside, properly distanced, while family and community members in their vehicles drive by to honor the graduates' accomplishments. It's a great idea, and I'm sure the people who thought of it would be happy if you stole their idea. Our vaccination program is making excellent progress. We are set to have 66,000 doses in arms by the end of this week. And as of today, we now have 63.5% of the entire population vaccinated. The progress is going well, and we expect to continue this rapid pace as we get increased shipments of Moderna arriving. We're still waiting for final details of amounts and dates, but extra vaccine is always good news. I know people want to get vaccinated, especially those who are eligible for a second dose. So we have plenty of vaccine, and we have lots of appointments in the coming weeks. So we want you to go online and book your vaccine appointment. And I'm going to close by circling back to testing. Our testing numbers have rebounded since last week, and I appreciate everyone who has gone to a testing site. But we still have the capacity to do more tests. And the more you're out and about and the more contacts you have, the more often you need to get tested, even if you've had one dose of vaccine. For people in HRM, there is still some community spread. So to everyone, enjoy your weekend while sticking with the phase 1 protocols. Get vaccinated and take time to get tested. We are very close to the finish line of this marathon, but if we race ahead, we may trip and fall. We are seafarers by heritage, so steady as she goes is the watchword. Continue to roar back by following protocols, testing, and vaccination.
We'll now take questions from media participating by phone. We'll take one question, one follow-up in the time we have allotted, starting with CBC's Jean Laroche. Go ahead, Jean.
Thanks, Heather. My question today is for the Premier. Mr. Rankin, your government has offered grants to small businesses to try and compensate them for their losses for forcing them to close. One of those small business owners contacted me today to say they were promised a check by the end of May. And here's a quote from their email. As of June 11th, nothing in the mail, no communications, no response to emails, no phone calls. And this person says the situation isn't unique to them. They've talked to others who are in the same boat. So my question to you is, what's the holdup? What's the problem?
Well, I don't know who this individual is. I know lots of checks have gone out for the Small Business Impact Grant, number 3, and we have augmented that grant in response to the concerns that we were shut down for the entire month. Going into June 9th was the plan. We're happy that we're able to open up a little earlier for some businesses, June 2nd with patios and reduced retail, and we'll continue to try to get the funding out, but I don't have the specifics of this particular individual business.
Go ahead with your follow-up, Jean.
All right, Premier, also for you, recently your government announced that it would be waiving ambulance fees for anyone with a COVID-related injury. We've heard from a woman who required an ambulance due to a severe reaction to her vaccine. The fee in this case was not waived. She was told this because she didn't test positive for COVID-19. Now, given that her vaccine is related to COVID, wouldn't this qualify as a COVID-related emergency? What direction can you provide EHS about this?
It could very well be eligible. We will meet the commitment that we said that we would related to COVID complications. So I'll take that back if you want to provide the information. There's some privacy that they would have to sign a waiver. The usual course is to go through your MLA to bring that forward, but if she wants to contact the department and provide the waiver for privacy, we can certainly look into that individual case.
Next, we'll go to CTV's Natasha Pace. Go ahead, Natasha.
Thank you. just wondering if you can talk a bit more about the Delta variant. Is there anything that we need to change what is being done in the province right now from a public health perspective now that the variant is confirmed? And can you also talk a bit more about the two people who were infected? Have they now recovered fully?
So the two cases were, we've reported them previously. We're just highlighting them again. They were individuals who were here appropriately in the province from international travel. They were quarantining as required and doing their testing, and there was no exposure to anybody else because they were following that quarantine. So their cases are considered resolved. We continue to screen our positives coming into the lab. To this point, we haven't identified any further cases of the variants. But we know that the Delta variant, like other variants, the key issues that they have is they're more infectious. We certainly know from our third wave about how that increased infectiousness can result in certainly significant surges of the virus. All the public health measures we take are necessary for, regardless of the variants. What they really mean is that the presence of variants means we have to all strictly adhere to the public health protocols, which are all built on reducing the chance for the virus, regardless of variant strain, from spreading. It also means that we have to be cautious as we're opening up because of the high infectiousness of these variant strains. The one thing that's unique about the latest variant, as I mentioned in my remarks, is a single dose is only modestly effective against this variant. So that's another strong reason of why we need to remain cautious until we start to get a much greater percentage of our population with two-dose protection against this, because it is growing in other parts of the country. The percentage of the cases that are the Delta variant is increasing. So we have to be careful that we don't have it here in a robust way in Atlantic Canada. New Brunswick did have an outbreak where they brought it under control. Took a significant amount of effort from public health. So as Atlantic Canadians, we need to continue to be very cognizant about the risks from the Delta variant coming into our region of Canada right now until we build up much higher levels of two-dose vaccine coverage.
Go ahead with your follow-up, Natasha.
Thank you. And just on testing, I know you talked about it a bit in your opening remarks, but can you reiterate for people how often they should be getting tested? We're still hearing a lot of people 15 months into the pandemic saying that they're not getting tested because they don't have symptoms or they don't need to get tested. So how often right now, as things are opening back up, should the average person be going out and getting tested?
Well, there's two ways that people should get tested. If you have symptoms, if you have been at one of the exposure notifications, if you're recently come into the province, or somehow you've other ways you've been contacted by public health and told you're a close contact, all those people have to go to one of the primary assessment centers and get tested. Everybody else who has no symptoms at all, we can either go to a PAC or go to a drop-in site. Either one is okay. There's no set frequency. That for most people, probably at least once a week. But we're saying for people who have the more contacts you have, whether it's because you're back at school, you're back at work, you're increasing your social activities, even within the phase 1 protocols, the more contacts you have because of all those, the more frequently you should be tested. But we're certainly asking everybody to build regular testing in to their, at least for the next few months, as we get through the summer, as part of their personal COVID protocols.
Next, we'll go to Global's Elizabeth McSheffrey. Go ahead, Elizabeth.
Thanks very much. Dr. Strang, can you provide an update on the AstraZeneca rebooking? Just wondering, how many second doses have been booked? What percentage of folks are choosing for mRNA vaccines over a second dose of AstraZeneca?
I haven't gotten an update on that. We're certainly going out through the email call out for both people who was first dose was AstraZeneca, and as well as people starting with those oldest 80 plus in the communities who their first dose was a Moderna or Pfizer. We're starting to bring both groups in for second dose, but it's only been for about a week, so I don't have any specific numbers. But nothing's been brought to my attention that we're having any challenges or issues with both of those rollouts to start second dose coverage.
Go ahead with your follow-up, Elizabeth.
Thank you. And the province released today some statistics showing the relationship between vaccinations and cases of COVID-19, as well as deaths, and cognizant, of course, that the vaccine rollout was moving a little bit more slowly, at the start of when some of these statistics would have been taken. I'm just wondering whether there's anything in those numbers that surprises you, or, what we can really derive from the information provided today.
So that's the breakthrough cases that I've been talking about for the last couple of weeks here at the briefings, and this is the third week in a row we're now releasing weekly reports. What it shows is that because no vaccine, including COVID vaccines, it provides 100% protection. We expect that some people after a first dose or even after a second dose, that there will be some people who get a COVID infection despite getting 1 or 2 doses of vaccine. That's normal and expected, but also what it shows is our numbers is that the percentage of people who are getting what we call those breakthrough infections is very low, and an even lower percentage of hospitalizations and deaths. So what it really shows is you can expect those breakthrough cases, but it also confirms the high level of protection that comes as people are vaccinated.
Moving on, we'll go to Keith Doucette at Canadian Press. Go ahead, Keith.
Good afternoon. Premier Rankin, I just want to double back to something you said about the weekend. And you said something about if things continue to improve over the weekend, we could move to the next phase next week. Now, the target's always been Wednesday. Are you kind of hinting that we could do it a little bit earlier, say Monday or Tuesday? It's only a couple of days. I just need some clarification there.
No, we said for phase 2 we would need a minimum of 2 weeks. I know there's a lot of folks that would like to see us expedite that plan, but as we start to open up, the 2-week incubation period is a really important separation. And as Dr. Strang reminded us, some asked for even longer than that. The federal government has proposed 3 weeks, even if as a more conservative approach. So 2 weeks was the minimum that we needed. That would be Wednesday the 16th, and because our cases look really, really good now, we're into single digits, we have a lot of confidence that Wednesday will be the date.
Go ahead with your follow-up, Keith.
And also for the Premier on the Atlantic bubble, when you say you want to reconstitute it, what exactly are you talking about? Because obviously we have target dates for reopening in each province to the Atlantic area that are roughly in the same ballpark. So essentially, I guess the bubble, whether it's recognized or not, kind of goes back into effect, or no? I'm just wondering what you mean by reconstituting it. Might it be maybe more coordination as to when you let other people from the rest of Canada come into the area?
Right. So the current status is still phase 3 for us, which is June 30th, if all goes well, looking at that 2-week period. But I'd like to see a potential Atlantic bubble if all goes well before then. The vaccines are rolling out ahead of schedule now. By the end of today, we'll be at 65%, which is our target for phase 3. And the other provinces have different plans. So I've been speaking with the premiers to look at the potential of something still late June. But if possible, if we open up first to Atlantic and we still have strong border control around the Atlantic region, then we can look at the ability for all of our residents to be able to comfortably travel in and out of our provinces. I think that would be good for our economy, and it's safe. But it will depend on all of our reopening plans. And again, I hope to have that group discussion later today.
Next, we'll go to John McPhee at the Herald. Go ahead, John.
Thank you. This is a question for the Premier. We've been told that a group of business people wrote you last week on relaxing isolation requirements for fully vaccinated people who want to get into the province. The new federal rules that were announced yesterday, I believe, say people who've had 2 doses only have to isolate until they get a negative test. New Brunswick and others are also easing rules. So the business community is wondering why Nova Scotia isn't doing the same thing.
Well, we are looking at that. The 2-dose protection does provide the right protection so that we can ease restrictions. We just need to validate that. So we're working on systems like other provinces are to be able to have that right control. Testing is part of our strategy as well. So if it's 1 dose, then we'll require some testing and modified isolation. But we're not ready to open up right now. our indoor dining's not even open. So we're in phase 1 right now. I would ask for patience and allow us to continue to work closely with public health so that we can get to phase 2, and then we can have a conversation about allowing travelers to come into our province.
Go ahead with your follow-up, Jean.
Thank you. This is for Dr. Strang. The second phase plan doesn't appear to address the status of long-term care residents in terms of increasing their mobility when they are fully vaccinated. Are there any plans to expand their ability to leave the nursing home, just be able to participate in more activities outside of the home if they are fully vaccinated?
Yeah, I just signed off yesterday on a more detailed plan for the continuing care sector around how we can continue to open up or ease the restrictions in the continuing care sector. We'll have more details on that as we talk next week about there's other areas that we will be providing more detail on as we get into the specifics of what phase 2 look like when we're opening that next week. And as we continue to open up phase 3 and phase 4, we'll continue to progress in those areas and provide that greater level of detail.
Next, we'll go to all Nova Scotia's Lindsay Armstrong. Go ahead, Lindsay.
Thank you very much. A question for the Premier following on some of my colleagues' questions. Given that we're rapidly approaching the 65% vaccine threshold set for phase 3, I'm wondering if you can help us better understand what potential changes might happen with future phases if we keep up at this vaccination pace. Would you consider adopting restrictions from later phases into earlier ones? Would you shorten existing phases? I recognize nothing's concerned, but I'm wondering what this could look like.
So the vaccination target is just one of our indicators as we move through the phases. It doesn't trigger the next phase. It's just important that we have that minimum protection of 1 dose as we start to look at our epidemiology, our hospitalizations, and those are the indicators that are looking positive for us. And that's why we didn't propose specific dates that you see provinces that haven't been able to reach those dates. But we do want to provide some certainty, and we were all in agreement that we needed the 2 weeks in place before we get to phase 2. But future phases could look a little bit different. We have that discussion on a daily basis with public health, and we'll continue to have those discussions based on our vaccine uptake. We have positive signs that we're getting even more supply now. So all these factors and the epidemiology in other provinces obviously will have an impact on our decision making with our borders as well.
Go ahead with your follow-up, Lindsay.
Thank you for that, Premier. I appreciate all those factors that go into those considerations. I'm asking about what changes, though, we could consider. What changes have you sort of deemed are potentially low level? You've talked a bit about these potential adjustments. I'm just wondering if you can give us any more of a picture of what that might look like.
The only one I'd be prepared to talk about is looking at the travel, because we are working on validation of vaccine, whether it's 1 dose or 2 doses, and we have a system now in place for rotational workers, which is a great start. We have further protection of testing at the Halifax airport, so these are the things that we're putting in place for broader protection. But beyond that, I still think that going through, if you look at the 2-week intervals, we have to base our plan on science. We have to be cautious. It's worked in the past as we got out of this wave, but we may have flexibility in future phases.
Next, we'll go to the examiners, Tim Busquet. Go ahead, Tim.
Hi, good afternoon. Dr. Strang, I was intrigued by your comment that 1 dose of vaccine doesn't provide much protection for the Delta variant. And I'm wondering how that applies to those of us who got their first dose of AstraZeneca. And just taking myself as an example, I've rescheduled for Pfizer for the second. Will Pfizer be considered 2 doses for protection of the Delta variant, or is it just a wash? And I and the rest of us who got the first dose of AstraZeneca, will we have to get a second dose of Pfizer or Moderna after that?
No, all the early studies, and they're ongoing, but it would point to the fact that it's 2 doses. And what I'm recommending is that if your first dose is AstraZeneca, your second dose is an mRNA vaccine, but the 2 doses provides good protection against all the known variants so far. But it's important to understand that it's 2 doses, not just 1, that is necessary.
Go ahead with your follow-up, Tim.
Yes, there's a Nova Scotia health employee, Chris Milburn, who's head of ER in Sydney, he basically went on the radio yesterday and said that you're power hungry and are misapplying your power. And the way I read it, he was discouraging people to get vaccinated. I wonder if you have any response to that.
I think he's had a strong response from the community in Cape Breton, and my only other thing would say he's trained as an emergency physician. I'm trained as a public health physician. I don't try to practice emergency medicine. He shouldn't try to practice public health medicine.
Next, we'll go to the coast and Victoria Walton. Go ahead, Victoria.
Thanks. I guess this is a question for both of you, kind of just about giving info to the public. Right now we're having these updates 3 times a week usually, but I'm wondering throughout the summer at what point, we can either expect updates to be less frequent. We were having them, I think, bi-weekly back in the winter or the earlier part of this year. I know, if cases go away or what phase do you expect to maybe stop doing them as frequently?
Yeah, well, it's a great sign that we're actually coming down with our newly reported cases, and so we are at the point where we can start to report probably less than 3 times a week. I don't think we're getting to a place anytime soon where we're not having any cases reported. That's what we're seeing across the country, and we were just finishing our 3rd wave at the end of the month of May. So credit to Nova Scotians to getting us to where we are. So in the future, you'll probably hopefully, you'll see a little bit less of us reporting on the screen.
Go ahead with your follow-up, Victoria.
Thanks. And Rankin, you said if the weekend goes well, we're on track for opening next week. Is there anything that could happen on the weekend that would cause phase 2 not to happen on time? Is there a certain number of cases? I guess Dr. Strang, you can answer that as well if you're interested. But yeah, I guess, is there anything that could happen that could trigger us not to hit phase 2 on time?
Thanks for that. You must have went to high school with me to say my nickname, my last name. So we will look carefully. This is not only the case number that's reported, it's the close contacts. If we have all of our cases, for example, with unknown sources, that would be very concerning. So it's a bit of an art for public health to make their own determinations on what they're seeing with their public health officers on the ground, the epidemiology, all those factors that we look at as we look at the case numbers. But all signs point to a positive outlook for next Wednesday for phase 2 reopening.
We'll wrap things up with Toronto News. Chelsea Gould. Go ahead, Chelsea.
Hi, good afternoon, Dr. Strang. People in Truro are upset at the denial of a drive-through graduation on a farm, and the reason given is because of gathering limits in phase 2, like you said. Can you help explain where the safety risk would be with people isolated in their vehicles, especially considering drive-through theaters can operate?
So drive-through theaters and drive-through faith services is a requirement for people to stay in cars. We know with the last year with the drive-in graduation that they were all built on people getting out of cars, going up, and we had unfortunately, and several of those that we had problems with adherence to limitations on when people get out of cars. There was mixing between cars. It's a time of excitement for graduates, understandably, and bringing large numbers of them together, with the risks about them not following the protocols is too big of a risk for us to take at this point, given some of the experience that we had with some of the so-called drive-in ceremonies last year. That's why I mentioned the drive past, where you have the graduates seated and everybody else is in their cars just driving past as a model they may want to look at. That there's other high schools that put that forward, and that can happen within the existing protocols and doesn't carry all the risks that a drive-in type of model with students getting out of their cars carries.
Go ahead with your follow-up, Chelsea.
Thank you. Given the low testing turnouts from the community sort of base, can you give us an update on where COVID tests are being driven right now? Roughly how many are targeted from exposures and how many are just from the community members getting tested?
I don't have a breakdown on that. I think, we have, when we do our case and contact follow-up, today we have 8 cases. So there's only going to be a small number of testing that's driven directly by that case and contact follow-up. We had almost 5,000 tests done yesterday. So a lot of that has to be people who are still coming forward and, in a way, our different streams, whether it's the workplace testing that I talked about, some of our pop-ups, other people just coming into our PAC. So we're pleased to see the numbers increasing, but we need to continue to have high numbers of people tested. I would say 5,000 should be our baseline, and we want to get well above that in the days ahead, because I keep saying that the more people are tested, the better information we have about the level of risk in community, which is important for us to then make solid decisions around how we reopen. So if people are anxious to get the reopening going, then help us out. Get vaccinated and get tested.
And that's all the time we have for questions today. Premier?
Yeah, and I'll echo those comments again on the testing, and I'll just focus more on vaccines. So as we said, we're approaching the 65% mark for first dose, but we're striving to get to 85% of our population. Those that are 55 and older have actually reached that milestone of 85%, 55 years old and up. I want to give a shout out to our 80-plus age cohort, where we have 97% of you receiving your first dose of vaccine, and 22% have actually received the second shot. All of our 75 to 79-year-olds have received their first shot, 100%. But 16 to 30-year-olds, we still have some work to do. You are at 65% coverage, so we need you all to get out and book your first shot. You're not only protecting those around you, but you're protecting the whole population in Nova Scotia. So get that shot in your arms to protect your family and friends and communities. There are thousands of appointments available to book your first dose around the province, and we need our youngest and most social group to get out and get vaccinated. So as you're planning for your weekend, I know you're planning to get tested once a week, so please plan to get your vaccine as well. Thank you and have a nice weekend.